Hello, my name is Vanessa Benjamin Roos. I moved to Granby, Colorado in Grand County from Manhattan, New York in December of 2009. And I'm about to share my mental health story, the struggles and successes. There is beauty in living in a rural area of the United States, but it also comes with a different set of problems, that level of isolation. We also have a great number of people moving to the county, whether it's full-time or part-time, and they themselves are dealing with different types of diagnoses, and there's not enough therapists up here that could help with the people already living here for the longest time. The other issue is that when the fires occurred, each troublesome, and then COVID came, a lot of people were forced into isolation again, already in an isolating environment, and that led to a whole plethora of other mental health struggles and issues. And when you don't have the resources for those types of unexpected events, it's very difficult to find someone that can help ease a lot of that suffering. And there is a large rate of suicides going on, unavailable help for even school children, and services are needed to keep up with the everyday growth that's happening and has been happening in our county for a while now. I wanted to discuss how well things have changed since an incident that occurred back in 2011. As I stated, we moved here in December of 2009, and there was a psychiatric crisis that occurred in regards to my DID, dissociative identity disorder, and it was handled very poorly. I ended up being incarcerated, and I had to go through a whole trial process of never being in trouble ever with the law or anything, and it was handled so poorly. And from back in 2011 to now, law enforcement, EMS, and Middle Park Medical Center, their nursing staff, have engaged with me and my husband in regards to how to improve on helping people who are in a mental health crisis. They've come to me and my husband. We've had multiple meetings, get-togethers, ways to work with people when they are struggling with mental health issues or having a psychiatric crisis that leads them to the emergency room. That when I was made to feel like a criminal in 2011, the way I'm handled now during a psychiatric crisis is incredible. It's engaging, it's not traumatic, it's more like a family compared to how it used to be. We all work in conjunction with each other, as well as my alters, because my alters are the ones that let law enforcement, EMS, and the hospital know that I'm struggling, that a crisis is about to occur, and instead of dealing with me like some criminal or someone who's going to completely lose it, they de-escalate and they cause a very, very high tense situation for me and my husband to simmer down and to work with everything that they're being given through my husband and the alters to allow me to go home, because that's the main goal, is for me to go home and not be inpatient. So how things used to be compared to now, law enforcement, EMS, and Middle Park Medical Center have come such a long way, and my family here and my family back at home and my family in Brisbane are beyond grateful for the outcome of all of this work. The one thing that Grand County could do to help improve the mental health quality of care in the county would be to work and engage with employers, to allow employers to see their employees who struggle with mental health issues as an individual, and to not base their diagnosis on how the individual works or manages everyday life, to treat them with respect and to treat them with great care, and to engage and to be open to having a mental health day if needed, or to openly speak with them in regards to the needs that they need with their employer. A great way for employers to engage with their employees and to just learn about mental health in general and the struggles that come along with those that have certain mental health diagnoses is to come to a meeting where everyone can engage on how to work with these individuals and to educate themselves, because we look like everyday people. You wouldn't know unless you saw the struggle or the individual spoke to you openly about it. So I would say having a meeting where we can all get together and have, speakers or even people like me engaging with the employers to educate them and speak with them in regards to how they can work with these individuals so their work experience can be a healthy one. I advocate for myself by going to meetings, anything that's engaging in regards to mental health. I had gone to a behavioral health task force meeting in Denver a couple of years back to advocate for better services and for the needs of individuals in my county and just in general. And my goal in regards to advocating is not just for me, but for people who feel alone, for people who feel they have to hide, for people that have shame in regards to something that they never asked for. And my sole purpose is to not allow what happened to me back in 2009 to 2011 to be made to feel like a criminal. I don't want anyone to ever go through that. I want to educate and advocate for those that need to speak up so they can advocate for themselves and friends and family. It's so important for people to understand that we are like everyday people. Everyone has struggles, some worse than others. But when we work together, when we work in conjunction with each other and we continue to educate and advocate, we can all work together to pretty much make any environment a safe and more happier place.